Hello everyone, myself Purva Mahale from IMAEC MEDNTEK. Welcome to IMAEC MEDNTEK's Infection Control Program. In this video, we will learn about the role of surface and environment cleaning in infection prevention and control. The hospital environments are always flooded with microorganisms, which can be the potential pathogens. The only way to get rid of these pathogens is proper disinfection. The microorganisms or pathogens present in an hospital environment are the main cause of nosocomial infections, also known as hospital-acquired infections. To control these infections, disinfection is mandatory at 3 major steps in a hospital, which are the instrument disinfection, the environmental disinfection, and the surface disinfection. The microorganisms in a hospital environment are found at the 3 major reservoirs, which are the surfaces, the air, and the water or moisture in the hospital environment. The surfaces in a hospital are contaminated by frequent touching by the patients, healthcare workers, or the visitors. Due to the coughing and sneezing of infected person, microorganisms are transferred to the air, and also because of the disturbance in environmental reservoirs. The water or moisture content present in a hospital facility also serves as a reservoir for waterborne microorganisms. The number and type of microorganisms present on a surface or in an environment are influenced by following factors: number of people in that environment, amount of activity in that room, amount of moisture in the room, presence of material capable of supporting microbial growth, rate at which organisms suspended in the air are removed, type of surface and its orientation. The chain of infection through surface and environment has some routes of transmission which can be checked to control the infection. The contaminated surfaces and contaminated environment acquires pathogens from infected patients, which is then transferred to the susceptible individuals through touching the contaminated surface or from the contaminated environment and infects the susceptible individuals. The hands of healthcare workers also play a major role in transmission of infection if they are not properly cleaned or proper hand hygiene practices are not followed. These contribute to the spread of infection. The another method of transmission is direct contact, where the infected patient and susceptible individuals are coming in contact. Air microbiology plays an important role in transmission of airborne infections. Due to sneezing and coughing of infected patients, some droplets are formed. These droplets contain the pathogens enclosed in the moisture. When these droplets settle on a surface, the moisture content is evaporated and the pathogens are released, ready to infect on the surfaces. The size of these droplets will define the transmission rate of airborne infections, as it determines for how long the particle stays in environment. The particle size 100 microns remains in environment for 6 seconds and then settles on a surface. The smaller particles like 10 to 3 microns remain for 1.5 hours in an environment. The more smaller ones like 1 or 0.5 microns remain for 41 hours to 21 days in an environment. Therefore, the particles with smaller size have a higher infection rate and higher transmission rate as they have the ability to float in environment for longer time. For infection prevention and control, there are three major steps of disinfection, which are surface disinfection, environmental disinfection, and instrument disinfection. IMAEC MEDNTEK has solution for all. Solutions for surface and environmental disinfection provided by IMAEC are the Disinfection DRLS 13N, which is a triamine based general purpose disinfectant. Disinfection R82, which is a quaternary ammonium compound and is a high level surface and environmental disinfectant. Disinfection W10, which is a surface, environment as well as water disinfectant, is composed of hydrogen peroxide and silver ions. The solutions provided for instrument disinfection by IMAEC are Disinfection OPA, which is a orthothalonaldehyde disinfectant for endoscope reprocessing, and Disinfection ID50, which is an amine-based surgical instrument disinfectant. Thank you for your attention. Hope you have an infection-free environment in your hospital with IMAEC MEDNTEK Ltd.